You see, um, we all agree on one thing, that our health-seeking behaviors need to change. And if you look at it, health-seeking behaviors do not change by cohesion, they change by education. So you use the example of the UK when the adverts for fruits and veg was going on. I can tell you now that for most supermarkets now in the UK, when you walk in, and all of you have been here, so you know that, you would find that there's free fruit for children. The supermarket it's selling fruit, but it also has free fruit, so that even while the children are walking with their parents and shopping, they can pick from the basket that says free fruit for children and eat it there. A clean fruit ready to be consumed. What are they doing? They are inculcating the behavior into the children at a very early age. Habits are picked early in life. As it stands now, it would be very, very difficult, especially for most adults who have got their palates well chilled, to teach them, especially less adventurous adults, to eat new things that they are not used to.
Yeah.
I mean, if you want an example, you see that when restaurants come to Ghana, how many people would go into a Chinese restaurant and try, mixed fried rice? I remember once I was in France and I was with some Ghanaian colleagues at the country. And we went into a Chinese restaurant and I said I wanted mixed special fried rice. And one of them said, na Kwame pardon our person would be. And I said, oh, mixed fried rice. I said, yes, I'm going to You see, so immediately, because the French are known to have a delicacy for frogs, the person was assuming, oh, I wouldn't try just in case I eat it. And what made it worse was another colleague I was with, who works with me, ordered for squid ink rice. I don't know if Kojo, you've seen it. They cook the rice and they use the
ink, the black ink from the squid. Yes. Yeah.
And that threw the rest of them off. And why am I saying this? I am saying it because we are traditionally not adventurous eaters.
Yeah.
So, and that is why I'm happy that Dr. Da Costa is saying this now. So the education, and that was why I left it at how do we fund it and how do we operationalize the operationalization should start from our schools, from the JHS and SHS, whilst trying to change the health-seeking behaviors of the adults. Because if you look at Ghana, our population pyramid, our median age is around 20.5 years, which means we have a very young population. And we know that a lot of these chronic diseases start when you go past 30. In fact, in the UK, at age 40, it's mandatory that your GP should call you in for a mandatory health check. You get invited on your 40th birthday, whether you are sick or not, to come in for a total health check. So if we want to do this fruit thing, that is what we have to do. We have to target it so that when the children get to about 25, 26 in the university, there will be a critical mass of Ghanaians building who are conscious about fruit eating, who are conscious about vegetable eating, and who would have picked the conversation about the doubling of our disease burden. What I simply mean by doubling of our disease burden, we already have the infectious diseases. But now, because our population life expectancy is increasing and our sedentary lifestyle and other things, we are getting these chronic diseases layering over the infectious diseases that we have. And this doubling of the disease burden is what is causing the problem. So we need to get the children and the young people to understand. And when they do understand, and when they are proactive seekers of healthcare, what will happen is that what's called our outpatient per capita, the number of times that citizen sees a health professional annually would increase. Currently, it's about 1.1, 1.2. We need to start inching it towards 4 once every quarter. If that starts increasing, then the health professionals would also pick these diseases. And the beauty of it is that for many of these screenings, it shouldn't be done by the doctors or consultants and all that. They can train what we call middle-level cadres, nurses, nursing assistants and all that, because things like taking phlebotomies to take the blood pressure, your pulse rate, cholesterol level, all these things in the UK are no longer done by, the high-level health professionals. So we need to have a comprehensive thought-through implementation, not just the promotion of fruit, but target the children in a holistic manner so that they understand. And also you tune them off. If I'm going to the hospital, I have to see a doctor. They come to realize that what you have to see is a clinician who is suited for the level of care you require, because we do not have enough doctors anyway. And therefore, if we do this and we do not train people properly, then we are also going to put pressure on the high-level clinicians, which they wouldn't be able to cope with, especially when there's a lot of health professional migration. And that is why I've answered your question by not just looking at the promotion of the fruit like the UK did, but to break it down to what they did with the fruit, how it impacted the younger generation, how they are continuing to do it in the supermarkets, and how this young generation is then picked up on their 40th birthday, so that any chronic disease can be picked up quickly. In the meantime, while they are in schools, giving the telltale signs of when they need to seek the help of a clinician. And I think a well-laid out plan with this in mind would also improve Ghana's journey towards universal health coverage, which we've already signed that we are going to achieve it in 2030. But we seem not to do a lot in that term. So for me, that is why I am very enthused about this conversation that Dr. Da Costa has led us all to be having, because some of us have been agitating for it for quite a long time. But now there's someone in authority who realizes that the NHIS would benefit from such a strategy. But it shouldn't stop there. I think this should become an electoral conversation this year, and we should see commitment, because you must bear in mind that a lot of things fail in Ghana not because the technocrats are incapable, but because there's not a political will to back it. If the NHIS has to do this, then the cap on the NHIS funding ought to go, because you would have to, you see, it's almost like you cannot get all these people to go into the hospital, so you would have to take health to them. So